For the next couple of weeks, we're going to be taking a road trip on this big green RV from South Florida all the way up to North Florida,
interviewing different nurses and learning about all the possibilities there are in nursing.
Getting to talk to people who are doing the work and experience what it's like.
We're currently in nursing school.
What's next? Finding that job, finding that position.
The journey is not about finding yourself, it's about creating yourself.
How do I know which path is best for me? Is it possible to take on these challenges and obstacles? Where do I even start? What should I do with my life? Sometimes the only way to find out is to go see what's possible. Since 2001, we've been sharing the stories of people who ventured out and explored different career paths and different possibilities for their futures. This is one of those stories. This is Roadtrip Nation.
So for the next couple of weeks, we're going to be taking a road trip on this big green RV from South Florida all the way up to North Florida,
interviewing different nurses and learning about all the possibilities there are in nursing.
Getting to talk to people who are actually in the trenches doing the work and experience what it's like in the real world as nurses. And maybe it'll give us some insight as to what we want to do in the future. There it is. Big green RV. Ah! Hi. Hi. It's so good to see you. There it is.
Yes.
Let's do it.
This is our home for the next 3 weeks, Logan.
I know.
When am I ever gonna have this opportunity again to like go on an RV and be with people that I've never met before and just meet nurses and learn about their career paths?
I only brought a travel pill. I was like, I'll be okay.
Yeah, and you're gonna regret. You're gonna regret.
Adrian and Maya, they actually knew each other previously to this. Is that something that they're gonna talk about?
Okay, so I'm gonna start off with Logan. We don't talk about Maya.
Well, some backstory. I know Adriana because we go to school together.
We're in the same cohort. We're also sorority sisters. This is a lot. Maya, technically, you don't need all that space.
No, I don't, because this is
yeah,
just...
you don't.
She said, I need that space.
We're so happy we're gonna be on this road trip together. And Logan is so sweet, like understanding, and he's so nice.
Honestly, the whole trip is gonna be so much fun.
Me and the other road trippers, we're currently in nursing school.
There's a million things that we have to do. I'm literally writing an undergraduate thesis right now. Don't ask me how much I've done.
I've got a test on Monday, and I gotta go back and take it in person.
Have you started studying?
A little bit.
No, you're so real for that. I'm so happy we're all on the same page.
Just think about the sleep after you find out you passed. That's what keeps us going.
That sounds awful.
Ready to get the show on the road?
Let's do it.
So we are interviewing nurses on this road trip.
Meeting people that are passionate in what they do and can share what keeps them going.
There's more to nursing than what we know. So yeah, I'm so excited. Okay. Somebody's watching me. Oh, I forgot you guys are not editing this. Hello, my name is Adriana. I'm 21 years old. I come from a very cultural background. I'm Haitian American. Welcome to my Caribbean household where we have an avocado tree here, a plantain tree here. I come from a big family. I'm the second oldest of 7. And this is my aunt and uncle. She's a nurse. She's the one that brought me into the healthcare field. And my late grandma. She always knew that I love to like help people and take care of people. And I got it from her. I see the statistics that comes with minorities and birth rates, and they're very low. So I want to be the change one day to make a difference in the world along that path. Once I graduate in May, I'll have my bachelor's in nursing. So that's just like the generic. And then I could further my education and get that higher degree in a concentration. And my concentration would be women's health. I do see myself maybe owning my own practice, maybe not. I'm currently a nurse extern on a med-surg unit Eventually, I have to put on my big girl pants and become a real nurse. My biggest fear is once I get into that field 15 years from now, like, am I still gonna have that spark, or is it gonna die down and then I switch paths?
We very much have these set expectations of this is what a nurse does, but there's so many other aspects.
There's so many different careers within nursing. This road trip will be really helpful.
Especially because soon it's going to be us. We're going to be out in the real world. So it's kind of exciting.
Today we are interviewing Nurse Blanca at Memorial Regional Hospital down here in Hollywood.
Florida.
Sorry.
Hello. How are you?
Nice
Blanca,
meeting you,
nice
Maya.
to meet you.
My name is Adriana. I'm a fourth semester nursing student. I am interested in labor and delivery, women's health, so I'm so excited. So excited.
So, my name is Blanca. I have been here for about 7.5 years. My first degree was in psychology, a master's degree in clinical psychology. I did that for about 12 years, and then I had children. It was constant pondering for those first 2 years as to whether I wanted to go back into psych or wanted to challenge myself and do something else. And my husband was like, well, you should think about nursing. And I was like, no. And the more I thought about it, I was like, it's actually a natural move. Like, I'll still be with people, I'll still be in healthcare. So yeah, I started off as a nurse in labor and delivery. I did operating room, obstetrical emergency room, and then had been a clinical manager here for about a year.
It's not a competition, but I got it done first, so it's just...
What qualities and skills do you think you should have coming into this job?
I think the qualities of nursing in general applies. You have to be compassionate, you have to be patient, and you have to understand that even though labor and delivery is usually a fun and exciting time, it's also scary. So you have to be empathic for that family's experience and understand that, it's a lot of times the first time a mom steps into a hospital. So understand that some of their anxieties that they didn't even realize they had are gonna come out, and you just have to be understanding, you have to be patient, and you have to treat the family. You treat them all because they impact her process.
How is it being a mom? Because to be honest, I have no kids and I have no responsibilities and I'm already stressed out. Like, I'm still consistently just baseline stress, especially in nursing school. Nursing school is such a well known for being a stressful, hard thing to do.
It was.
How did you do it? What advice would you give?
Well, I think my kids trained me because I had to learn time management with them.
Yeah.
Okay.
So I got to nursing school. I was like, I don't have the luxury of a whole day off to study. Yeah. So it's all about time management. My calendar is everything to me.
As we know, nursing days are long, 12-hour shifts. It's nice because you get the 3 days on and 4 days off.
Right.
But how would you say that your work-life balance is, being that those 3 days and having a family, you're gone for most of the day? You leave early and you come home late.
For me, it's great because I don't have to take time off of my job for dentist appointments and doctor's appointments because I schedule it accordingly. So to me, I feel like in nursing, that kind of helps, I think. I would have a hard time working 8 to 5.
I was about to say that. I'd never thought about that.
Yeah. So I think that's a plus. You want to go have lunch with your girlfriend, you can do that because you have days off.
Coming from a Haitian background, I feel like that's one of the reasons why I chose nursing. Like, we're a community where we're always helping each other. So I do know you're from Nicaragua, right?
I am.
Do you feel like your cultural identity has shaped your way of caring for your patients or any way?
I think so. I come from, big family oriented. So that was very natural to me. It's caring and to look at, not just your patient, but the family as a whole. So definitely I think that, my culture and my background of being family oriented has helped me because I don't see them as just one person. Also from leadership to, our nurses on the floor, to the physicians we work with, it's truly a family.
Do you see yourself going back to school?
Maybe, yeah. I just haven't figured out what I want to be when I grow up.
So real.
I guess it's one of those things that it's nice to have all those options, but it's also scary to have all those options.
Absolutely.
There's too many choices.
So many choices.
When you're a nurse, you can do whatever unit. You can move wherever you want in the country. You can go back to school. You don't have to go back to school. You can go into leadership. I'm losing my mind.
I know. There's so many options in nursing.
So many.
So if you start off in an area that maybe it's not your favorite, You can always move. So don't give up. Keep going.
I definitely see myself working for them. It really solidified like my passion for women's health. She has a big family. We're both like from the islands. Oh my gosh. If I could be so inspired by this first interview, and this is only the first, imagine how the other interviews are gonna leave an impact on me.
I feel like I connected with Blanca that this was her second career, because I started my career in the marketing sales world, and it's scary changing careers, but it's nice to hear that you're never too late to go back and do something new, something different. So I'm currently a second degree seeking BSN nursing student. I enjoy spending time with my family and my husband, who's a doctor. My pets, I have 2 cats. I love cooking. Quiche Lorraine, which is what this is. It's just a super common French recipe and it tastes good and I like it. I don't know. So I grew up in Central Georgia. I had a great childhood. My dad worked as an engineer and my mom was a nurse. That's when you were cute.
It didn't last very long.
You were too much of a keeper?
I guess so. I guess so.
Oh, cute. I was very close with my mom. She unfortunately passed away a little over 10 years ago after a long history of battling breast cancer and a couple of other different types. That was really difficult. But I got to see my dad care for my mom as she slowly declined. Right at the end, there was a point where my mom needed to have morphine given through a syringe into her mouth. The nurse came and she showed us how to do it. And I just remember seeing my dad saying, I can't do this. I can't. But he did. He took on that caregiver role. And in that moment, it made me realize just maybe caring for people and helping them to get better, or even just helping them get through the worst point of their lives, is something that I could see myself doing. You showed me like what nursing was about. You acted as a nurse for so long, and it never occurred to me before, because you took care of mom.
It's a caretaker.
It's a caretaker, yeah, and you were so instrumental in me choosing to do nursing. I know. I really hope that I can live up to the legacy of not only my mom, but also to my dad, and make a positive difference in the world. I just hope to make them proud. So I'm hoping that all of the interviews can help me narrow down what I want to do within this field, because I have no idea what I want to do. Today, we're going to speak with Tracy Penny, who is a volunteer nurse at Shepherd's Hope Clinic in Winter Garden, Florida.
So I get to see a lot of good things at Shepherd's Hope. I see a lot of interesting things. We had this lady come in and nobody could figure out what was wrong with her knee. She had been itching, and they just kept saying, you know, it's just a vein. And it turns out she had a worm in her knee. She gardens on her knees, and she got a larva through her skin, and it hatched, and you could see the worm.
That is crazy.
Crazy. So it's really incredible what we see come in there.
So can you tell us a little about what is Shepherd's Hope?
Shepherd's Hope is a community health center for the uninsured. So when I was looking for things to do in nursing, I wanted to give back, because just because you don't have insurance doesn't mean you're not eligible or qualified to get health care.
At what point in your nursing career did you feel like, oh, I got this? Like,
I would say probably 10 years in.
10 years.
Wow.
I'm not surprised by that. I'm honestly not.
But I knew a lot after my first year. I've done CVICU, oncology, I've done pediatrics.
Say that's a long list already.
The health department. I've done home health care, community health care. If you name it, I've done it.
I mean, you mentioned some really interesting cases. Has there ever been a particular patient or interaction that you had that has just really solidified like your love for nursing, or particularly working with this organization that just really spoke to you?
Yes, my son was a competitive skateboarder, and he was put on Oxycontin, so he became addicted to it. So he went to a rehab facility, and he ended up overdosing and passing away.
I'm so sorry.
Thank you. But my point of this is, it's 12 years later, and I'm able to talk about what I know to all these men that come in with all this knowledge that I have about drug use because I studied it, I took my CEUs on it. I hope that by hearing my story, they don't go out and overdose, so that I don't read about another addict dying. To say, hey, this doesn't have to be your path anymore.
That's amazing. The fact that you were able to turn such a negative experience into a positive one, it's just amazing. It's
Yeah.
amazing. What would you want to do to inspire the next set of nurses that want to leave that lasting impression, that want to persevere? What advice would you give?
Just remember that the patient is the most important thing. And if they tell you something's wrong, believe them. You guys are going to be great nurses, I can already tell. But community-centered healthcare is a great way to go too if you have any free time. Even if it's one day a month, you might see some interesting things like that worm in the knee.
I'm never going to forget the worm in the knee.
Literally.
The fact that she uses her son's death to teach others to prevent that is very inspiring.
I definitely see myself doing some community healthcare work.
You think so?
Yeah.
It was never something I
definitely.
considered.
I never even knew this was a thing.
And what are you going to do?
That's a good question. I don't know yet.
You are so funny.
What?
You would do well with patients that you can talk to. So not ICU or not CVICU, something in a surgical ward where you are having day-to-day talking to your patient. Yeah, you would do well with that.
Oh, okay. I'll keep that in mind.
Be your patient's advocate because you may be their only voice.
Thank
But I
you.
can't wait to see where you fall.
Same. I'm still very excited to figure that out myself. I've been studying on the road trip. I'm still in school currently. It's fun studying on the road. It's not fun. I hate studying. I actually have a test coming up that I have to study for.
Me and the other road trippers were trying to balance our last semesters in nursing, trying to, solidify that post-grad job.
Just trying to keep up with everything that is going on with school as well.
It's gonna be on our right, so get in the right lane.
We did our late night games. Logan brought this game from his home. It's called Phase 10. Do I know how to play it now? No. Will I play it again? No.
2 sets of 3, which could be 3 7s, 3 10s, whatever. They can be any of the colors.
It's just too many rules, too many steps. And I feel like Logan's a cheater. He's good at everything, so please, I don't want to play with him no more. I don't want to play with him no more. I'm done.
I got this. Did I win yet?
Put down that. No, get rid
Can
of
I play
those.
these ones?
Play them on top of it. Could we imagine working together?
On the same unit?
Yeah.
I can see it.
Y'all would be separated like that. They'd be like, these two, no, absolutely.
Everything would be a two-person job. Oh.
2-person assist.
Hello?
I can ambulate on my own. No, you can't.
We'll help you.
So we're about to talk to 2 people who took their experiences in nursing and turned them into businesses.
So we are interviewing Craig Jordan. He's a psych mental health nurse practitioner with his own practice, Recovery from Society.
And we're speaking with Sylvia Walker.
She went from a bedside nurse to a nurse manager, then she was on the corporate side for a little bit.
Miss Sylvia's brand is Noabi, natural as I wanna be. All her products are natural and organic. She started this because of her own eczema, and they create these products so patients feel better about themselves, feel beautiful in their most vulnerable state at the hospital. She's still making an impact.
I love people, so I knew that I would always work in a field that I would serve others. I knew that much. But I really didn't know what was my true passion. And so ICU, I did do a little bit of that, but when I was a young nurse, because of my eczema, they didn't have latex-free gloves back then. So that's why, when I got into skincare, I knew that I wanted to do something totally different.
Can you tell us a little bit of history about you, what you do?
So how I got here, I worked in inpatient psych at a hospital for 2 years, and I also worked inpatient facility as well too. So I learned a lot of inpatient psych, and I loved inpatient psych because it was just so exciting. It was just the adrenaline and not knowing what you're gonna get into.
I took some extra chemistry classes, graduate school, I took some additional courses. So I took that leap of faith. I just really wanted to do something that would not only help me, but help other people. Also, patients in hospitals, especially women of color, don't have access to products that work for us. And so they say, you're doing something that nobody's doing.
Why did you transition from bedside to then wanting to have your own practice?
So inpatient, I would say, gave me that trajectory to start my own practice because I was seeing a lot of the clients, when they would discharge from the hospital, they didn't have the proper care to follow up with psychiatrists, or a lot of the clients could not receive that quality of care for because they didn't have the proper insurance. So I figured the biggest thing to making a difference and to change the lives of members, the community, would be to open a private practice that would accept all insurance companies. So my typical day, mostly medication management, psychotherapy, and I also provide medication management for clients in the group home. So for at-risk youth in the community, that's an underserved population. So I have a passion for the youth right now.
Thank you.
It's yours.
Thank you. Thank you.
So this is a facial cleanser.
I love it.
And this is a beard oil.
Ooh. Look, my hands aren't oily, they're just soft.
And especially to being a nurse, after you wash your hands, apply a little bit and they keep you moisturized all day. It's a sleeping cap, actually.
You forgot to!
Thank you.
Last night.
I was like, we have to stop somewhere. I need a bonnet.
Skincare is not trendy. It's a necessity. It's your largest organ.
Within your business, how on rough days, how'd you push yourself to keep going? Because I know as a Black woman, starting a business on your own is not always easy. So how did you keep going?
Definitely, as a Black woman, and even today, as you know, still less than 3%
Exactly.
of Black businesses get investors, and make it to, that next level, mid-level. People will say you can't do it. Don't be afraid. The key really is don't be afraid to venture out and do anything. And always listen to that inner voice first. That'll let you know if you're going down the right path.
And the business side of it, we're not taught business, anything in nursing schools.
Exactly. Even when I Google it, I don't find nothing.
Yeah, you Google is singing a rabbit hole. ChatGPT was singing a rabbit hole. So definitely starting with the SWOT analysis, looking at the market, looking at the demographic you would like to treat, and also grind 6-7 days a week and make it work.
And remember, all three of you, that life and the journey is not about finding yourself, it's about creating yourself. The you that you want to be. Each chapter of your life is a stepping stone in your journey. So what I did when I was a nurse are things that I had to do at that stage of my life for me to get where I am now. You may start in one place in nursing, but you may end up somewhere else, but you're still in nursing. You may end up further than your mind you could ever dream possible.
You're making such a huge impact in everyone's life. I'm moved right now, and I feel like I could take on the world when I leave here. So thank you.
We're almost halfway through.
We're almost done, and I can't believe it's going fast. Very fast.
Just like nursing school?
Yes, just like nursing school.
I'm not gonna lie, this is my first time staying in an RV, and it's not as bad as I expected.
But it's also fun. It's like a sleepover every day.
Literally.
Like me and Nana will be in there giggling.
When I do have my own practice, I do want to just make a difference, help women and children. It sounds great to me.
Hopefully, at the end of this trip, it'll kind of help me narrow down what I want to do within this field.
I would say that with the next nursing leaders, the things that I want to know most is what keeps them going, because my biggest fear about being a nurse would just be experiencing burnout. I'm excited to see what people I meet and where this journey goes next.
On this road trip, we are traveling across Florida,
And a big green RV.
interviewing different nurses.
And learning about all the possibilities there are in nursing.
Because soon that's going to be us. We're going to be out in the real world.
My biggest fear about being a nurse would just be experiencing burnout.
Once I get into that field, am I still gonna have that spark?
Everyone always says there's nothing worth doing in life that isn't hard, but don't give up. Keep going.
Wondering what to do with your life? Well, we've been there, and we're here to help. Our website has some awesome tools to help you find your path. And you can check out all our documentaries, interviews, and more. Start exploring at roadtripnation.com.